we reached 2 milestones. Number one, we tragically have now lost the lives of over 2,000 people in the state of California. The number of deaths in the last 24 hours were not encouraging, but were part of that bucket of discouraging and devastating to the families that have been torn apart because of a loss of a loved one, and the communities impacted by the loss of one's life that was integral into the quality of life for so many. 91 people lost their lives in the last 24 hours. That number yesterday was up. Today, in similar vein, we're now over 2,000 people have lost their lives. Don't think this virus has disappeared. Just ask the family members of those that have tragically lost loved ones. We also reached the second milestone, over 50,000 cases of positive test results that have come back for COVID-19, over 50,000 now. Those numbers went up again. Now, the good news is so did our testing. Over 655,000 tests now been conducted, still not close to where we need to be. But by the way, it's May 1st. I wanted to get here by May 1st, and we've been averaging over 25,000 tests every single day, just as we said we would. I say that, I'm not spiking the ball, I'm not naive, that number can be fleeting and challenging based on supplies and based upon many different factors, but yesterday was close to 30,000 tests that were reported. I just remind you that were reported in. We still believe there are many tests that are not being reported. We're doing everything we can to get to everybody, but there are a lot of individuals, a lot of groups that are doing testing that we just need to get in the system. But that's encouraging. But the testing comes with those discouraging numbers of more positives. And I just want to remind you, deaths and positives reached some very important milestones. We're not out of the woods. But the good news, I mentioned good and discouraging, is our ICU numbers were flat yesterday. Our hospitalizations actually went down 2% yesterday. And then that PUI, I know I said PUA, this is all confusing, and I understand that and appreciate it. The PUI number in relationship to ICUs, intensive care units, and hospitalizations in the state is an important number, and that's people under investigation for potential COVID that are in the process of getting test results and the like. We saw a significant decline, 13.9% in both categories, ICUs and hospitalization yesterday in the PUI space. So flat in terms of total ICU beds, but a drop in PUIs, a modest decrease in hospitalizations, but a nice drop in the PUI. So that's good news. Bad news, positives, deaths. Good news, stable line that you have provided us the opportunity to announce because of your individual behavior and the physical distancing that you have done at scale in this state. That's why I feel some confidence that over the course of the next week, we're going to be able to make some announcements that will give people some more confidence in the ability for California to get back on its economic feet. So no one wants to hear the word patience, so I won't use that word. I'll just reflect on the fact no one wants to hear that word. None of us want to hear it because we're all impatient and we're deeply anxious and deeply desirous to start to turn the page and turn the corner with all the modifications that are required. The data is starting to give us more confidence, PPE, testing, our ability to begin very, very deliberative modifications in the progress of getting this guidance ready to deliver to counties, cities, and regions all across the state. And so that's a broad stroke. Forgive me, a little long-winded, but broad strokes update on an important day where we reflect essential and displaced workers and thank everybody out there for their hard work, their sacrifice.